Hello, Dr. Greenwood.
How are you, Judge Gravell?
I'm doing great. Can you talk just for a little bit and let me get my volume up to the right? All right, are we ready?
I'll start it. So. Good morning, this is Connie Odom, Public Affairs Manager with Williamson County. Thank you for joining us for the media conference for a COVID-19 update from County Judge Bill Gravell and Dr. Nathaniel Greenwood, Chief Medical Director for Family Hospital Systems. We will be taking questions at the end. If you could put those in the chat, then I will read those. And if you're not already on mute, could you please mute yourself? And we're ready.
Well, good morning and welcome back to Williamson County. I'm glad that we can meet together virtually. I think you'll be delighted at the end to hear from Dr. Greenwood, who's the medical director for Family Hospital Systems, and we'll give an update there. I want to give a general county overview and update on the COVID vaccination response through this morning. We have vaccinated 52,176 folks here in Williamson County, and we're beginning to move at a higher rate of speed, really doing a really good job in multiple areas. Just this past week, we had the vaccination locations at Kelly Reeves Stadium, and for the first time, we had a vaccination location at the Georgetown ISD football stadium. And it was a bit of a test run, but it went really well with about 1,100 folks being vaccinated this past Wednesday. Williamson County, effective today, will be assuming the maintaining of the waiting list for folks here in Williamson County. So regardless of which provider you may be vaccinated with in the days ahead or which provider will be providing vaccinations, Williamson County will be maintaining that database of the waiting list. You're going to be impressed. You can go to wilco.org. It should be up and running by noon today, but wilco.org, and just simply look at the waiting list. What's unique about it is you'll be able to put in some identifiers for those of you that have already registered for the waiting list. And by the way, everyone that is registered for the waiting list will be imported into the system, and you'll be able to check your status, not necessarily your place in line, but you'll be able to check your information to make sure that it's correct. It's also really helpful too, if you've already been vaccinated somewhere else, it's an opportunity for you to remove yourself. Please remember that there are well over 100,000 people that are signed up on the waiting list. And if you've gotten vaccinated somewhere else, it'd be really helpful if you would remove yourself from that list. This past Wednesday, we started our call center here in Williamson County to help answer vaccine-related questions. And just in 3 days, we received 16,303 telephone calls. That's at our phone number 512-943-1600. Now, the first couple of days, we just struggled keeping up with demand, and in fact, we couldn't. And we have beefed up that area by adding additional personnel and the technology to help us answer those phone calls. We definitely want to be there for all of our residents who need someone to talk to over the phone. Our technical assistance centers, our VERDIS centers, are off and running. Our Sun City VERDIS Center is up and running again today, and we're really excited to announce the second VERDIS Center is up and running this week tomorrow at First Baptist Church in Taylor. The address is 2500 Mallard Lane. Beginning on February the 9th, that's tomorrow, they'll be open every Tuesday and Thursday from 9 to 3 p.m. So if you need some help with getting on the waiting list, or if you have questions, or you can't operate technology and you want someone to help you, you'll be able to go to the VERDIS Center in Taylor for that assistance, as well as our Sun City Ballroom that is at 2 Texas Drive here in Georgetown. And that facility's operating hours are Monday, Tuesdays, and Fridays from 9 until 5 p.m. And then next Monday, we're launching our third location, which will be Hill Country Bible Church, and the address is 3300 Little Elm Trail, and that will be in the gym building, or the gymnasium building there in Cedar Park. And so starting on February the 15th, they will be opened every Monday, Wednesday, and Friday from 9 until 3 p.m. So our Virtus centers are up and running, they're trained, they're doing really an exceptional job, and we're appreciative of that. I will tell you, just anecdotally, this past Friday, our Virtus Center in Sun City, in one day alone, with about 20 county employees, was able to assist and help over 500 residents. So we're trying to put the resources out there to help the people and to help them be successful. I want to talk a little bit about the vaccine distribution this week, and I want to talk about it from a kind of 30,000-foot view, and then I'm going to ask Dr. Greenwood to give you a more granular view on what they're doing at FHS and how that affects us. This week, Williamson County is receiving 9,700 vaccine doses. And on Monday and Tuesday, those doses will be administered at the Kelly Reeve Stadium by FHS. And then on Wednesday will be another inoculation day of 1,500 folks at our Georgetown High School athletic complex. I'm going to have to put on my glasses to read because we have a lot of new participants this week that are really helping. And I think what you will see is that agencies and entities are working together to solve problems. And as county judge, I'm amazed every day at the humility and the servant's heart and the working diligence of everyone to work together. And these are some examples. This week, for example, there will be 700 additional doses provided to nursing home and long-term care facilities. A newer facility to us as far as vaccine administration is starting this week. The WellMed Center in Leander has received 400 first-time doses. There's been 100 doses for the Lake Air Med Center here in Georgetown. The health district, in fact, has received 1,500 doses, 500 from last week and 1,000 this week. The 500 from last week are being directed exclusively to our long-term nursing care facilities and our senior care facilities. Our health county EMS are doing an amazing job at locating those entities that haven't been able to vaccinate our seniors. Our seniors are our most precious crowd, and for those that want it, we want to get shots in arms. As well, that health district will be shifting over 1,000 doses. 500 of those will go to Samaritans in Leander, and another 500 doses will be going to Sacred Heart in Ramrock. Samaritan and Sacred Heart are both facilities that care for those that are uninsured and often those that are indigent. So we're really grateful at the collaboration, not only between our family hospital systems, other providers that are receiving doses, as well as our health district. It's also understanding, and we don't know the particular numbers, but that our CVS, or one of the CVSs here in Georgetown, will be receiving doses as well. There's another 100 doses or so that are being provided to Lone Star Circle of Care in Cedar Park. And I think that covers about the list of the 9,700 first doses that we have for this week. This week is not going to be complicated. All of these entities are exceptional at administering the vaccine, and they do it really well. Next week is when it gets complicated, because next week, not only do we have the first-time doses that are coming in, but we'll begin to see large quantity of second doses coming in. So this week, 9,700 first-time doses, plus the additional second-time doses for this week, which I expect will be another 1,000 to 2,000 doses. But the following week, it's going to get really complicated. Very thankful for our partnership with the family hospital systems. They have done nothing but say yes every time that the county's had a request. Very fortunate. Dr. Greenwood is the Chief Medical Director of Family Hospital Systems, and he's here to give you an update on the particular vaccine administration for the hub for the county. And then following that, if you have questions, if you can put those in writing in the chat, and then Dr. Greenwood, Connie will be diverting the questions to me or you that's most appropriate. So again, we're grateful that you're all participating today and helping us get out the message, but we're making progress. Now, with that being said, one last thought before Dr. Greenwood speaks. For us to vaccinate the 1A and 1B population in Williamson County is about 210,000 residents, or about 420,000 shots. If we continue to get 8,000 to 10,000 doses a week, according to my math, it will be sometime in June before we even finish with 1A and 1B. So this is a long slog, a long haul, and it's going to be complicated, and we've all got to work together. Williamson County is doing a really good job. It would be helpful if we had more doses. So we'd be grateful when we get more from the President, the White House, and from our state authorities. Dr. Greenwood, thank you for joining us today.
Thank you, Judge Gravell, and I have the same sentiment as you. Our partnership has been, I'm very grateful for it, and it's been nothing but yes from our Williamson County leadership. Very grateful for taking the wait list. That was definitely a burden. There's just the need is huge, so I appreciate the help with that. And these Vertiv centers to me are just so instrumental. We really struggled getting those who can't navigate computers very well and getting them in the system, and so this is very beneficial. So thank you for getting those set up. So far, over the last 3 weeks, we've done about 22,000 first dose vaccines. We use the stadium parking lot setup in order to do these large quantities because it helps socially distance as people stay in their vehicles. And, we're doing 12 lines at a time, and we're doing, one vaccine every 2 minutes. And that's what has allowed us to get up to these large numbers. And your math is correct, Judge. It's gonna take a lot of time. But if we can increase the quantity in the meantime, then we can get those things done quicker. And of course, as a hub, every week we are requesting more and more vaccine because we know what the math is, and we're just trying to get everybody done as quickly as we can. Like you mentioned, we do have the second doses, a large amount of those starting next week, and we're working out the details with that. Of note, I think it's well known that there's been an issue with people jumping the line and sharing of sign-up links, and we are very shortly going to be rolling out a process where that'll be prevented, where only people who are given the link that's associated with them will be able to sign up with that link. So I think that'll resolve a lot of the issues that have come up with people jumping the line, as we call it. But overall, I don't think I've worked so hard in my life doing something. But it's so important, and just the reception from those that have come through our lines it makes it all worth it. And the tears of people who have been inside for the last almost year, and getting a glimpse as they get that vaccine that I'm going to be able to see my family and my friends. It's really important. So sorry to get a little emotional, but it's I'm happy to be in this position and be lucky enough to help get Williamson County out of this pandemic. I'll I'll turn the time back over to you, Judge.
Thank you. Connie, you have some questions for us today?
We do. Alex from KXAN is asking, what has been your experience in communicating with the state when explaining Williamson County's needs and desires in the vaccine allocation process and plans of improvement?
You know, Alex, that's a really good question. My experience in dealing with the state is that they've been really responsive. They've listened every time we've spoken with them. We present a weekly PowerPoint presentation and a white paper asking for additional doses. So the state's been really responsive. But let's be clear, the state only gets so many doses per week. And I think my job as county judge is incredibly difficult. I can't fathom being the governor of Texas who has to be fair to 254 counties. And sometimes fair is not even appropriate because there are some counties down along the border that are on fire with the COVID vaccine. And as governor, I'd be dumping all the resources I could down there to save lives. So it's not just about being fair, but it's having the resources. The state's been really responsive, but the truth is we're only getting 300,000 to 500,000 doses a week from the federal government. And before we make a significant dent in Williamson County, we will need to see 1 million doses a week in Texas.
Alex has a follow-up question. What have you learned from Austin Public Health's vaccine rollout that has helped you with your own processes?
You know, what we've learned from Austin Public Health is that it's important to have a collaborative relationship, not just with governmental partners, but also with the private sector as well. We have learned, and I think the real solution to many of the challenges that we face is not more government or governmental entities doing it. It's public-private partnerships. Family Hospital System is a great private partner. We have another private partner that's coming online next week, Curative. And so we've got another private partner who's ready to put shots in the arms as soon as they get doses. It's Scott & White Healthcare Systems, along with many others. So I think what we've learned from the Austin model is that it's important to have public-private partnerships, and everybody's kind of rowing together in the same direction.
And then we have Fernando with the Taylor Press asking, can you tell us more about the verticide in Taylor, and will there be any doses sent to the Taylor area?
Well, first of all, let me say this. I'm grateful to Taylor. When we had a need, we did a call with area pastors, rabbis, ministers, clergies, and the pastor, it was Pastor Ryan from First Baptist Taylor, was the first one to say, you know what? I want to take care of the people in my community, and we're willing to open our facilities to help answer questions and to help our seniors and young ones that are technologically challenged. So we're grateful to First Baptist Church in Taylor. But as you know, it just seems to be normal in Taylor that they always jump in to help out whenever there's a crisis. I remember at the very beginning of the pandemic, it was your superintendent who had the idea of delivering meals to kids, and we delivered over some 600,000 meals here in Williamson County. As far as when we actually get vaccines in Taylor, I think it's further down the road than we would want, but it's not as far as we think. Our game plan right now is large mega sites to drive through. And that is the Kelly Reeve Stadium first, Georgetown ISD second, and then third, the Dale Diamond. And once we get enough doses to stand up these mega sites, then we'll begin to look at other locations like the Taylor Expo Center. I think it is at least 4 or 5 weeks down the road before we even get to that. We've got to have more doses to put more shots in arms before we can add other sites.
And then for Dr. Greenwood, Brittany with CBS is asking, can you speak more about the policies you're putting in place to prevent line jumpers? When do you expect to put those policies in place?
Those policies will be in place before the end of the day. So it's definitely something we've been working on for a long time, and now we finally reached the point where we can roll those out. So there'll definitely be more detailed instruction to those who are on the waiting list and those who are currently signed up in our portal.
And Brittany, let me just add, it is immoral and it is unethical to step in front of a senior adult to get a shot. Now, if you qualify in the 1A, you should sign up. But if you don't, it's just wrong. And you need to, and everyone needs to realize that if you're choosing to step in front of people, you're stepping in front of your own grandma and grandpa. And you know what? I pray that someone's not doing that to my parents over in Lee County. It's important to be respectful and wait your turn.
Oh, we have another question from Alex. How will signing up for a second dose differ from signing up for a first? Are you aware of any delays in receiving second doses from the state? This is probably best for you, Dr. Greenwood.
So I am unaware of any delays in getting second doses. We have received second doses for a smaller rollout that we started at the end of December, and we've received all second doses to match the first doses. Obviously, when we're getting into the bigger volumes, time will tell, but there's no indication at this point that we will not be getting the second doses. And I think that's throughout the state. That has been the case up to this point.
We lost. Can you repeat that, Dr. Greenwood? I think we lost your volume.
Okay. What was the last thing you heard?
Go ahead and repeat the whole answer.
Okay.
So in terms of the second doses, we did a couple weeks of smaller volumes of second doses starting in December, and we have received all second doses for those first doses that we previously gave. There's been no indication up to this point that we will not receive the second doses for our large volume that we started about 3.5 weeks ago. We do have people scheduled for that second dose starting next week, and to go along with a link that is specific to certain individuals and can't be shared, we will be providing a second dose link for those that have not received an appointment up to this point. So there will be communication made with all those who have received a first dose through FHS.
Okay. And then Tony at the Patch Judge is asking, given the hard work in distributing vaccines, why was a priority placed on opening bars when the notification was given of a lowered 7-day hospitalization rate for coronavirus cases? Are these efforts not at odds with each other?
No, absolutely not. Tony, the one thing that we've learned is that it takes a balance of all of the pieces. It's about balancing the economy with public safety. It's about balancing our schools and our school systems. We've also learned, too, that we were mistaken at the beginning. For example, we shut down schools. And with shutting down schools, we've realized that as far as it being commutative or being able to increase the spread of COVID is just actually not proven out with that data. Opening bars is about opening businesses and keeping our economy alive. Listen, if we just made decisions based upon healthcare measures, we would have locked down everything a year ago. Or if we just made decisions based upon businesses, we wouldn't have locked down anything. So it really is a balancing act in trying to place all the pieces at the same time. And I would also mention to you as well, Tony, the governor's listed some really good guidelines about the 50% occupancy, 75% occupancy when our hospitalization rate gets below a certain level. Our hospitalization rate for the Region O has dropped dramatically in the last 10 days, and I expect it to continue.
Okay, and Judge Christopher with the Sun is asking, how are the Verta sites maintaining the health privacy requirements for HIPAA?
You know, Chris, that's a great question. Everyone that works at the Verta sites goes through HIPAA training, so they have to be compliant with that. We were also concerned about the ability of someone to use technology and perhaps capture your data or my data. So the equipment provided at the Verta sites is all county-owned equipment, county-maintained equipment, and secured equipment. I mean, because we care about our folks' confidentiality as well. And I think we're doing a really good job at maintaining the privacy.
Dr. Greenwood, Claire with the Statesman is asking, any idea when Johnson & Johnson vaccine might be available?
I do not know. That's a question for the Texas DSHS.
Okay. And then Allison is asking, Dr. Greenwood, if you can give any other details about the exact policies to prevent line jumpers, or will it just be more information sent out to people when they receive their appointment emails?
So there will definitely be information sent out to people when they receive their appointment emails. We're going to be utilizing our waiting list, and you know, the policy on that will be followed strictly. And just so you're aware, from our standpoint, the Texas DSHS has said you can't ask people to prove what status they are. You can simply ask, are you a 1A or 1B patient? And if they say yes, we're done. If they say no, we kindly ask them to leave and just let them know that, hey, this is for people who are 1A or 1B. So, and you know, we're just following what we've been told to do at DSHS. And again, like Judge Gravell mentioned, it's just important that you know, are honest and realize that there's a plan in place to get everybody vaccinated, but we just need to do it the right way and the right time frame, and just believe in the system.
Okay. Follow-up, Judge, you might have this number. Can you clarify how many second doses have already been distributed by Wilco and how many Wilco has ordered to begin distributing next week?
Well, our request for next week, I know, is over 10,000, and it would be sometime Saturday before we know what that number is. As far as the first dose and the second dose breakdown, I don't have that in front of me. I refer often to the DHS website that actually has the number of doses allotted to the county, the first dose, the second dose, so you can refer to their website.
Okay, and then Casey from Fox is asking, it's a question that does not have to do with COVID. So we're not taking questions that are not related to COVID right now, since that's the topic of the press conference. So we can answer that one at another time. I'll get back with you on that. So I think that is the end of our allotted time. If there are no more questions, that should be it. Judge, if you want to close.
Yeah, I just want to close with a thought. And Dr. Greenwood is just the epitome of what family hospital systems stand for. And the reason why I share this story, he doesn't even know I'm going to tell this story, but the first person I met from his family was actually his wife. And his wife was working at one of the locations, and she was helping, you know, get the paperwork in and helping. She was just being a servant, and she was there filling in. And they told me, Doc, that it was actually your wife. And then I met Dr. Greenwood, and you know, my experience with the family hospital systems, as well as every other provider and county employee, is we're all hands on deck. And nobody is too important to take phone calls. Nobody is too important to serve our seniors. And it just was a wonderful example to me of a family that was all in. So Dr. Greenwood, thank you for your passion and love for Texas, and especially Williamson County. But you and your wife are an inspiration to this old judge. Thank you.
Thank you, Judge.
All right, you guys have a great Monday morning, afternoon.
Bye-bye.